So my name is Dr. Martynas Juozaitis, and I am a pain consultant in Shropshire, as well as having private practice in regenerative medicine in Chelsea in London. I've been in UK for 15 years, and my main interest is musculoskeletal pain treatment, and especially spinal pain treatment. For last 3 years, I was involved in opening and running with my colleague the private regenerative clinic, which provides regenerative treatments based on Regenexx protocol. We have been quite successful, and despite all the struggles and COVID and pandemic, our practice is increasing, and I'm hoping that we can help people to achieve their objectives and be more functional and pain-free and enjoy their lives. Regenexx is a United States-based company which was started by Dr. Chris Centeno more than 15 years ago, and it is the company which developed regenerative treatments using own body stem cells and platelets, as well as other biological chemicals produced in our bodies. The difference in Regenexx is that Regenexx been researching and providing treatments for over 15 years, and by now it has a wide network of very well-trained clinicians who within the network provided over 70,000 treatments. Regenexx has a more than 5 years dating register which follows thousands of patients, and therefore we are very well aware which treatments are effective and which treatments are not so effective, as well as aware of the risks and complications as well as benefits of a treatment. Now, the difference in Regenexx treatments is that it is medicine, and they are medical treatments provided by the doctors. Those doctors, they have to be assessed and trained in United States by Regenexx clinicians. They have to pass exams, and they have to meet the standards to provide the good quality treatments which are compliant with Regenexx standards. Regenexx has got the research department, the specialized department who only interested in researching and making sure that the treatments which we provide are safe and effective. We do not provide the treatments unless they go through long and safe and very detailed research process in the Regenexx laboratory and Regenexx clinics. All Regenexx treatments are provided using specific image guidance, and all Regenexx orthobiologics, that's how we call platelets and bone marrow derived stem cells, as well as alpha-2 microglobulin, they processed in small laboratories in the clinics, and this gives a very good quality control, as well as we can concentrate the cells whichever we use into much higher quantities in comparison to the bedside centrifuge. So altogether, with assessment of the patients, with research, with image-guided precise injections, with training, which is a standard training for all clinicians within the network, as well as the register data which follows patients. We have a multimodal approach to the treatment, making it safe, researched, and the most effective currently, to my knowledge. In our clinic, we mostly focus on musculoskeletal conditions, and those can be due to degeneration, due to the aging process, as well as due to the injuries which people can acquire during their ski holidays or sports or athletes. And this is where our scope is. There will be some other fields in regenerative medicines where stem cells can be used. However, our main interest is spine and musculoskeletal conditions like osteoarthritis or injuries, ligaments, tendons, and muscles. And we treat all the body, regardless where the injury is. We are trained and we can provide the treatment for the patients. So, yeah, there is no typical procedure. Each patient is assessed individually, and during the assessment, we make a plan as to how we will treat this patient. Now, we apply a holistic approach, and we think that there is no one part in the body. Everything is connected, and we have to treat the body. So therefore, quite often we identified more core problems, not just what patient comes complaining with. And procedures will depend on patient needs and the areas treated. However, normally patient would be assessed by one of our clinicians. And we are quite a small clinic, which we are proud to, because patients are normally speaking to the same clinician. They meet the same members, which makes it easier, and they get used to us. And also we know our patients very well. So in the clinic, patient will be assessed, and this can be a video clinic or it can be face-to-face clinic, and it may involve ultrasound scanning. When we make a plan, we agree with the patient what we do. Sometimes we need to optimize patients' conditions in order to respond to the treatment, and therefore we may occasionally make some alterations to treatment which patient takes for other chronic conditions if this is likely to affect the treatments which we provide. We liaise with their general practitioners or with a patient. We may do additional investigations if it is required. And when patient comes to the clinic for the treatment, in the clinic, normally patient is consented, and when, if required, we take some blood if we require platelets to process from it. Sometimes we need to take bone marrow for aspirate to process the stem cells and bone marrow concentrate. Patient has a comfortable waiting area. We treat one patient at a time. We don't rush. Patient has overtime. We using specific laboratory techniques to process the biological materials which we need, which taken from the patient, bone marrow or the blood. Then we re-inject into the areas which require the treatment, and we focus on the functional treatment, which means we want to give opportunity to the patient to heal using their own body stem cells or platelets. And we do a very specific image-guided injections into injured sites. Sometimes we need to inject other areas which may contribute to the condition, which patient complains or which affects him. And when patient has a recovery, we make sure that they are safe and well, they can mobilize. Some patients may require some bracing, some patients will require crutches. They are discharged, they are given instructions for rehabilitation following our treatment. And they also have an access to clinician if they have any questions or they have any queries about their recovery. so they could contact one of us with their questions. Right, so there are advantages and disadvantages in everything in life. So the main advantage of regenerative treatments and Regenexx treatments probably are that we are using fully autologous, fully compatible own body platelets or the stem cells. Therefore, there can't be any reactions or compatibility issues. We check if the cells are alive, we make sure that they are safe, and therefore our treatments are very safe. They also are minimally invasive, and obviously they have less risk in comparison to the surgery. Now, saying that, sometimes surgery is unavoidable, and if you have a trauma or sometimes there are some sinister reasons, there is always be a place for the surgery. However, with regenerative medicine, we're bridging that gap, which in the past patients had no access to the treatments when they still don't need a surgery, but however they already have some symptoms, or they cannot have surgery, or they don't want a surgery. And therefore now with regenerative medicine, we can offer treatments to those patients in this group, which is fairly large group. Patients have no change in biomechanics. Patients have no artificial metal or implants or plates or screws, which sometimes affects the immune system. And therefore, our treatments long-term, they have less impact on the patient degenerative conditions or general body conditions, if you say. Sometimes patients, it's not just the surgery. Some treatments are completely non-invasive treatments, like a physiotherapy or alternative treatments, or there are some mental techniques. And to be frank, every treatment has its place and time in the patient's life. And the most important thing, I think, is to take into consideration patients' wishes and patients' autonomy as to what we want to have. However, sometimes with no treatment, patients haven't got enough stem cells or enough healing materials in the body, which is in the body part which is injury, and therefore advantages against no treatment is that we can take the stem cells or platelets from one area of the body, like blood or bone marrow, and we can inject them into the area which needs healing. And therefore, the chances of healing are higher with a treatment than with no treatment. So I think the main advantage against no treatment is that the chances of healing often are better. The advantages against the surgery is that our treatments are less invasive. They do not change biomechanics of the body in case when the tendons or bones are shortened or taken from other parts of the body. And we don't leave any artificial bodies in the human body, like plates or screws or any metals, which can affect immune system or sometimes can cause other problems. And the main advantage is that it is a simply choice for the patients who are cautious about their health, for the patients who don't want yet to have a surgery, and they want to live a more functional life. They want to be pain-free, they want to move around. They can simply have regenerative treatments using their own body orthobiologics, like stem cells or platelets or alpha-tube microglobulin, to extend the good quality of life for a few more years. And I think that's very important. So I was trained as a pain consultant, and I think a lot of times we focus on treating the pain. However, we also need to understand pain is a symptom, And just by treating the symptom, we don't always address the core problem. And sometimes by addressing the core problem, we can achieve better results with less risk, and those results will last longer. When I started looking into regenerative medicine, I used to treat the pain, and sometimes we used to denervate the body parts, so there is no pain signal coming through the nerves. Sometimes we used to inject anti-inflammatory medicines like steroids to reduce inflammation and reduce the pain. But I felt that it can be some better ways to manage the problem rather than to manage the symptom. And using stem cells and platelets, now effectiveness will depend on how advanced the degeneration or injury is. And it depends on where the injury is. And we have a specific system in Regenexx based on those thousands and thousands of patients' responses which are analyzed via the register data. We know which patient is going to respond to which procedure, and we can give quite accurate percentages to the patients in consultations, and we can say your response will be over 80% or your response will be over 60%. So patient could make informative decision about their treatment. And I think this is another one of the advantages of being Regenexx network clinician, that we have this enormous amount of data which we can analyze and we can base our decisions on, and we can give this accurate prognostic forecast for the patients regarding responses to the treatment. And we focus on treating core problem. Now, if core problem is treated, the pain will of course go away. And then pain as a symptom won't be bothering the patient. But I think we can achieve much more with regenerative medicine and stem cell treatments because we can improve the function. And patients can climb the mountains, they can go cycling, they can go and play golf, and they can simply be much more functional. They improve the stability of the joints, they improve the function, they improve the spine health. And I think that's probably even more important than the management of pain. Pain as a symptom will go away if the core problem is addressed and treated. And yes, we can help a lot of patients and we can treat a lot of problems. There is no treatment which is effective for everything, and there is no treatment which is effective 100% for everyone. But I think regenerative medicine using stem cells and platelets and alpha-2 macroglobulin, we can treat a lot of conditions and we can help a lot of people, and we can help more than I could help in the pain clinic using the ordinary injections of steroids or denervations of the joints. The cost will depend on the treatment, and because our treatments are fairly individual, I don't think we can put like one cost to the procedure. The costs are normally discussed with the patients, and they can make their own decisions. At the moment, unfortunately, those treatments are not reimbursed by the insurance company or NHS. I hope in the future it will change, and I think slowly the companies are catching up. Some of them will approve it for the patients, and patients may inquire with their companies. However, the cost, all the patients, they can inquire, and in the consultation, when we know what treatment is required for the patient, then normally we discuss the cost, but it is less than the surgery, nearly always, nearly 100%, due to us being less invasive. However, cost, obviously there is a cost in the treatment because we are part of Regenexx, and therefore we are contributing with payments of franchise. We're using up-to-date equipment, we're using imaging, ultrasounds, x-rays, we're processing everything in laboratory conditions. And having with specialized and high quality safe treatment will always have some cost. But on the other hand, as being a small clinic, being a small team, we don't have a huge management machine. We don't have complications, at least yet. So our costs, I think they are reasonable. They are less than the surgery, but they might be sometimes a little bit more than ordinary pain treatments.